Good morning! It's August 19th, and this is your daily brief in science. Here's everything you need to know. The recent end of the Texas measles outbreak marks a significant milestone after infecting 762 people since late January, resulting in 2 child deaths and 100 hospitalizations. The outbreak, linked to cases in Canada and Mexico, spread across several states, including a recent case in Colorado involving an unvaccinated adult, bringing the state's total to 20 cases in 2025. Health officials confirmed no new cases for over 42 days as of August 18, 2025, declaring the outbreak over. Despite this, authorities will continue monitoring for new cases through testing, vaccination, and education efforts to prevent further spread. The U.S. had achieved measles elimination status in 2000, but outbreaks in under-vaccinated communities nearly threatened this achievement in 2019. In 2025, there have been 32 measles outbreaks across more than 40 states, more than doubling the number from 2024, which puts the country's measles elimination status at risk. Internationally, Israel reported over 500 cases in the past 3 months, and a second death of an unvaccinated 18-month-old child, primarily affecting unvaccinated children. The recent large outbreak in the U.S., initially linked to a Mennonite community, was among the largest since measles was declared eliminated, highlighting the importance of public health responses. The containment of this outbreak demonstrates the effectiveness of public health measures. Experts reaffirm that there is no scientific link between the MMR vaccine and autism, and the vaccine does not contain mercury or thimerosal. The MMR vaccine remains safe and highly effective, having drastically reduced U.S. cases from 500,000 annually before 1963 to just 47 in 2023. Continued emphasis on vaccination and monitoring is essential to prevent future outbreaks and safeguard public health. A new study published in Nature Cell Biology reveals that the endoplasmic reticulum, or ER, in epithelial cells changes shape dynamically in response to tissue gap curvature. This shape-shifting helps cells move during wound closure. The research shows that these ER morphological changes depend on cytoskeletal components like actin and microtubules. Microtubules are especially important in convex wound scenarios, aiding cellular adaptation. Mathematical models demonstrate that ER reorganization reduces mechanical strain on cells during migration. This suggests the ER acts as a mechanotransducer, linking physical cues to cellular signaling pathways. Professor Fabian Spill highlighted that this work connects organelle shape with cell behavior, revealing a new mechanism of mechanotransduction mediated by organelles. The study emphasizes the value of combining experimental biology with mathematical modeling. It raises questions about how organelles influence tissue formation, repair, and development. Researchers suggest that ER reorganization may guide tissue responses after injury and impact cellular sensing of mechanical stimuli. Professor Tamal Das noted that this enhances understanding of how mechanical forces influence cell behavior, relevant to senses like touch and balance. Dr. Pradeep Keshavanarayana pointed out potential medical applications, including therapies for wounds and cancer metastasis. He emphasized that understanding ER-mediated mechanotransduction could improve tissue regeneration and slow cancer progression. Collaborative models from the University of Birmingham suggest ER reorganization minimizes intracellular strain energy, optimizing tissue repair efficiency. Researchers from the University of Nottingham have identified key factors influencing chocolate flavor during cocoa bean fermentation, including temperature, pH, and microbial communities. Their study analyzed fermentation processes across farms in Colombia's Santander, Huila, and Antioquia regions, revealing regional differences in microbial activity and flavor profiles. The findings suggest that shifting from traditional spontaneous fermentation to a standardized, science-driven process could improve flavor consistency in chocolate. The team developed a curated microbial consortium that replicates natural fermentation results in laboratory conditions, validated by advanced microbiological techniques. This approach offers practical benefits for smallholder farmers by providing a method to achieve consistent, high-quality fermentations, potentially boosting economic prospects. Practical methods, such as applying microbes from the outside of cocoa pods, could allow farmers to manipulate microbial communities without sourcing external cultures. The research draws parallels to other fermented foods where starter cultures have improved quality and consistency, indicating a similar potential in cocoa fermentation. Experiments with sterilized cocoa beans fermented with these microbes produced liquors with enhanced citrus, berry, floral, tropical, and caramel flavors, confirmed through taste tests. Understanding microbial metabolic pathways like glycolysis and amino acid catabolism is crucial as they generate key flavor compounds. The microbial combination was described by Professor David Salt as the secret sauce for improving cocoa quality. While this advancement enhances flavor and consistency, it does not address broader issues such as environmental impact or child labor in the industry. Researchers from the University of Pennsylvania have identified 2 brain regions that encode a person's forward-facing direction during navigation in virtual environments. Using neuroimaging data from 15 participants, they found that these regions maintain consistent neural signals across different visual settings and task phases. These areas function as a neural compass, representing a wide range of facing directions relative to the north-south axis. This discovery provides evidence of a human neural compass similar to head direction cells previously observed in rodents. The findings, published in the Journal of Neuroscience in 2025, have implications for understanding navigation deficits in neurodegenerative diseases such as Alzheimer's. The study emphasizes the importance of integrating visual and internal cues for effective navigation, which could aid early detection and monitoring of diseases involving spatial disorientation. It also highlights the potential for virtual reality as a scientific tool beyond entertainment, useful in neuroscience, education, and rehabilitation. Limitations include a small sample size and reliance on virtual environments, suggesting future research could explore augmented reality or real-world navigation. Understanding environmental interactions with neural mechanisms is crucial as urbanization and technology impact cognitive health. The research advocates for interdisciplinary collaboration across neuroscience, psychology, and virtual technology fields to further explore human navigation and cognition. These brain regions could serve as biomarkers for neurodegenerative diseases affecting spatial awareness. Overall, the study sheds light on how the brain maintains a coherent sense of direction despite changing environments and limited visual cues, using advanced virtual reality and encoding models to study active navigation. Opus Genetics has received FDA clearance for its IND application for opus-genetics-gets-fda-approval, a gene therapy targeting BEST1-related inherited retinal disease. This marks a significant milestone for the company and the IRD community. The therapy uses an AAV-based platform to deliver a functional copy of the BEST1 gene directly to retinal pigment epithelium cells. Its goal is to restore protein expression and improve retinal function in patients with this rare condition. Preclinical studies in 2024 showed that a unilateral subretinal injection was well tolerated in canines, with no significant toxicity at low and mid doses, though high doses showed some retinal signs of toxicity. The targeted disease, BEST disease, affects approximately 9,000 patients in the U.S. and causes progressive vision loss or blindness, with no current approved treatments. A primary focus of the therapy is vitelliform macular dystrophy, including its early onset form known as BEST disease. Opus plans to initiate a Phase 1/2 clinical trial in the second half of 2025, involving genetically confirmed patients, to evaluate safety, tolerability, and early signs of efficacy. The trial will be multi-center and open-label, involving a single subretinal injection, and will measure visual function and retinal structure changes. This development builds on promising preclinical results and aims to restore the function of the BEST1 gene in retinal cells, potentially offering a groundbreaking treatment. It is Opus's third ongoing clinical program, alongside others like OPGX-LCA5 and partnered products such as phentolamine, ophthalmic solution 0.75%. George McGrath, CEO of Opus, emphasized the importance of the FDA clearance and highlighted the lack of approved treatments for BEST1-related IRDs, reaffirming the company's commitment to addressing this unmet medical need. This has been your Daily Brief in Science. To read more about these stories, follow the links in the episode bio. You can also subscribe to these updates via email at www.brief.news. For more daily podcasts about the topics you love, visit brief.news/podcasts. Tune in tomorrow. We'll be back with everything you need to know.